first question we may have is, what is the COVID-19? The COVID-19, a name coined by the WHO, that is the World Health Organization, refers to the coronavirus disease, which first broke out in China in December 2019. Because the earliest cases were detected in Wuhan, China, some people call it the Wu flu. The coronaviruses are a family of viruses, meaning there are many kinds. Some kinds cause the regular and harmless flu, like your stuffy nose and runny nose with fever and body aches, and some cause the more dangerous diseases like SARS. The new kind of this same virus is the one responsible for the present illness spreading around the world, which is why it is also called the novel coronavirus.
I will be telling you the symptoms of coronavirus disease, or COVID-19 as it is called. The symptoms usually appear 2 to 14 days after exposure. Severity of symptoms range from very mild to severe. The initial symptoms are like a common cold: runny nose, muscle aches, sore throat, cough, and more severe symptoms are fever, cough, and shortness of breath. Statistically, 80% develop mild symptoms, 14% have severe symptoms, and 6% become critically ill. Those who have a higher risk are people above the age of 60 years and people who have pre-existing medical conditions such as asthma, diabetes, or heart disease. If you do live in or have traveled to an area where coronavirus disease is spreading, stay at home until better, even with mild symptoms. Get medical help immediately if you have fever, cough, and trouble breathing. Remember, anyone can get coronavirus infection, but if you are not in an area where COVID-19 is spreading, have not traveled from an area where it is spreading, and have not been in contact with someone who has it, your risk of infection is very low.
So we have heard what is COVID-19 and what are the signs and symptoms. Now there is no specific treatment or vaccine for COVID-19 till date, but we can prevent COVID-19 by adopting certain basic measures. The first and foremost is hand hygiene. This includes frequent washing of hands with soap and water, and also use of alcohol-based hand sanitizers. The reason is that the virus can sustain in the environment and on surfaces for a longer period of time. The second is by practicing cough hygiene. We all know that we need to cover our mouth when coughing and sneezing, either by flexing the elbow or by use of a tissue paper, and as soon as you use the tissue paper, it needs to be disposed after use. The third is by maintaining a distance of 1 meter from anyone who may be coughing or sneezing. The next measure is avoid touching with your hands your face, eyes, or nose. This is because your hands might have touched a virus surface which could be contaminated with the virus, and hence this is an important measure.
What must you believe about the COVID-19? Now there are a lot of myths out there, especially on Facebook and WhatsApp. You shouldn't believe all of them and circulate them. Instead, go to a legitimate website such as www.cdc.gov, which is the Center for Disease Control and Prevention, or www.who.int, which is the international website of the World Health Organization. Make sure you get your facts from a trustable source, especially before you spread it, because false information can cause unnecessary panic.